Sudden infant death syndrome is the sudden and unexplained death of a seemingly healthy infant under 1 year of age, with most deaths occurring between 2 to 4 months. According to the American Academy of Pediatrics, SIDS, also known as crib death, strikes nearly 2,500 babies in the United States every year.
SIDS is not entirely preventable, but you can take steps to reduce the risk.
Early and regular prenatal care can help reduce the risk of SIDS. The risk of SIDS is higher for babies with mothers who smoked during pregnancy.
Infants whose mothers smoked are 3 times more likely to die of SIDS. Do not be around smokers or in smoke-filled rooms. Exposure to secondhand smoke doubles a baby's risk of SIDS.
New moms are encouraged to breastfeed to help reduce the risk of SIDS.
Researchers believe that breast milk protects babies from infections that increase the risk of SIDS.
You'll want to make sure that your baby's crib is safe. You can confirm this by following the standards of the United States Consumer Product Safety Commission. Their safety guidelines can be found online at www.cpsc.gov.
Place your baby to sleep on his back. This should be done for nighttime sleep and naps. This is recommended by the American Academy of Pediatrics. Do not place your baby to sleep on his or her side. There is too much risk that he will turn over onto his stomach.
According to the American Academy of Pediatrics, there is no increased risk of choking for healthy infants who sleep on their backs, but it's recommended that parents consult with their child's pediatrician to determine the best sleeping position for their baby. And if you're concerned about your baby getting a flat head from sleeping on its back, remember, give your little one lots of tummy time when awake and limit the amount of time in bouncer seats and car seats.
Remove all unnecessary objects and items from the sleep area, such as extra blankets, bumpers, soft toys, pillows. Place the baby to sleep on a firm sleeping surface, such as a safety-approved crib mattress. Never on a pillow, waterbed, sheepskin, or any other soft surface.
To keep baby warm, use a sleep sack or a blanket sleeper instead of a blanket. Make sure not to overdress your infant. Keep the room at a temperature that's comfortable for an adult wearing a short sleeve shirt.
Researchers believe that babies who get too warm go into a deeper sleep and are unable to awaken.
The American Academy of Pediatrics also recommends keeping baby's sleep area close to but separate from adults. Infants can be brought into a parent's bed for nursing and comforting, but should be placed back in their own crib or bassinet when ready to sleep.
Use of a pacifier at sleep time can lower the risk of SIDS. Pacifiers should be used after 1 month so as not to interfere with breastfeeding. Pacifier use should not be forced. Do not reinsert it after the infant falls asleep.
And while a monitor can help you keep an eye on baby, it's no substitute to checking in and observing your little one. Home monitors should not be used to reduce the risk of SIDS.